Hello everyone, good evening. Welcome to this Facebook live session. I'm Dr. Hardik Jain. I'm a chest physician and allergy specialist practicing at Sir Jain Reliance Foundation Hospital, Mumbai. So we are having this Facebook session today because this week from 18th to the 24th of June is World Allergy Week. This World Allergy Week is marked every year in order to raise awareness about different allergic conditions. So, allergies are one of the most common cause of sicknesses worldwide. Allergies affect 1 in every 5 people, that is roughly around 20% of the population. Most of the allergic conditions are not life-threatening, but they have a significant impact on the quality of life of our patients. So, what exactly do you mean by allergy? Allergy is a condition where the immune system of the body gives an abnormal reaction to certain foreign substances which are harmless for most people. These substances are known as allergens. Most of the patients with allergic conditions are sensitive to more than one allergens. Why do allergies occur, or what is the cause of allergies? Normally, the immune system detects and eliminates harmful substances such as bacteria and viruses. But in some people, even certain harmless substances are treated in the same way. This mainly happens in people with a genetic tendency or a family history of allergies. So in such people, when first exposed to the allergen, the immune system creates an antibody called IgE. So this antibody recognizes the allergen, the particular allergen, and on subsequent exposure to that same allergen, the IgE antibody triggers an allergic reaction, and this reaction leads to release of certain chemicals, mainly histamine. The histamine is the one responsible for all the symptoms of allergy. So the most common allergens which lead to this triggering of the allergic reaction are house dust mite, mold, that is fungi in the house, animal dander like cats and dogs at home, cockroaches, pollen, that is tree pollen, grass pollen, certain foods, most commonly milk, eggs, seafood and nuts. And besides these, other uncommon causes of allergy are latex and maybe some insect bites. What are the different types of allergy? Allergy can affect many organs of the body. So allergy of the eye is called allergic conjunctivitis, nose allergy is called allergic rhinitis, allergy of the airways and bronchi in the lungs is known as asthma, bronchial asthma, allergy of the food pipe is called eosinophilic esophagitis, and allergy can affect the skin, which can manifest in different ways like atopic dermatitis or eczema, urticaria, angioedema, and in some certain severe cases, allergy can affect multiple organs at the same time, which is known as anaphylaxis. This is a life-threatening condition and requires urgent, immediate treatment. Symptoms of allergy depend on the organ involved. So, allergic conjunctivitis can present as watering of the eyes along with redness and itching in the eyes. Allergic rhinitis presents as itching in the nose along with sneezing, blockage of the nose, running nose. Asthma, as we all know, presents as breathlessness, coughing, wheezing and a sensation of chest tightness. Allergy of the food pipe may present as nausea, vomiting, and of course allergy of the skin presents as rashes, redness and itching all over the skin, may involve one or different parts of the body. So how is the diagnosis of allergy made? In order to diagnose the allergic condition, your doctor will take a very detailed history from you, mainly the history of the symptoms. So what exactly are your symptoms, how severe they are, what is the duration, how frequently they keep coming back, and certain more aspects of the symptoms. Besides that, we also need to know the family history, how many other family members are having similar conditions. There are certain tests which can diagnose allergy. First of all, there are blood tests. We look for the total and specific IgE in the blood, which can help us get an idea of the allergic condition. And there are also allergic skin tests. So skin tests are mainly skin prick test. It involves the introduction of very tiny amounts of the allergen into the skin, and we wait for some time and then we look for the presence of any reaction. So depending on which allergens give a positive reaction, we can identify the presence of allergy in that patient. So moving on to the treatment of allergic disorders. The most commonly practiced treatment is medication. There are lots of medications available to control the allergic conditions. Most commonly we use antihistamines and steroids in different formulations. Sometimes we also use nasal decongestants, we use bronchodilator inhalers for asthma, we use many skin creams for skin allergies. So different kind of medications are available, but the thing to remember is that these medications only control the symptoms of the allergy. They do not address the underlying cause of the allergy. If patients are not satisfied with the effect of these medications, or if the symptoms persist despite optimal treatment, then we try and identify the underlying cause by doing the skin prick test or the blood allergy test. And once we identify the cause of the allergy, the culprit allergen, then we can advise the patient to avoid that particular allergen. So for example, if the patient is allergic to house dust mite, then we can advise some measures to avoid the dust mite at home by making certain changes in the patient's house. And suppose the patient is allergic to pollen, so then we can advise using a mask whenever patient is stepping outside the home, and so on and so forth. And in certain cases, rare cases where the symptoms persist despite avoiding the allergen, or in cases where it is not possible to avoid the allergen, which we see in many cases, then what we can offer is allergen immunotherapy. Allergen immunotherapy involves the administration of very small quantities of the allergen into the body, and it is done in a safe manner, and at regular intervals we increase the quantity so that the body gradually develops an immunity to it, so the body becomes immune to that allergen. This is a widely practiced and established way of treating allergies. It is practiced worldwide, and it is quite effective, but we need to be very careful in selecting the right candidate for allergen immunotherapy. So to summarize, allergies are a very common cause of illness worldwide. They can affect one or many parts of the body, and depending on the part involved, they can present with different symptoms. The diagnosis of the allergy can be made by a doctor through the allergy skin prick test or via blood tests, and once a proper diagnosis is established, we can offer some treatment for the allergy by means of medications. A variety of medications are available, and in certain patients where medicines are not working effectively, we can even offer allergen immunotherapy. At Sir H. N. Reliance Foundation Hospital, we regularly see a lot of cases of allergy affecting different parts, and we are able to help a lot of patients in this way. So if you or any of your friends or relatives have any such complaints, please feel free to approach us. Thank you very much.